Good morning. As Zambia joins fellow Southern African Development Community SADC member states in commemorating SADC Malaria Week during this week of November, it is important to recognize that this period coincides with the start of increased malaria transmission session. This year, SADC Malaria Week is observed under the global theme, Resilient Health Systems and Communities Key to Malaria Elimination. Supported by the slogan, a quote, timely access to malaria services, everyone's right, end of quote. This theme highlights the critical importance of delivering quality health services as close to communities as possible, ensuring timely and equitable access for all. In marking this regional event, I'm pleased to provide an update to the nation on the current malaria situation in Zambia and to some extent share key advancements made in the fight against malaria. Ladies and gentlemen, malaria remains a significant public health challenge in Zambia and continues to rank among the 10 diseases responsible for hospital visits and admissions. I'm encouraged to report that this country has recorded notable progress in malaria control. Malaria cases have decreased from 11.5 million in 2023 to 9.5 million in 2024, representing a 24% reduction in malaria incidence from 403 cases per 1,000 population in 2023 to 305 cases per 1,000 population in 2024. Of these cases, approximately 16% occurred in children under 5 years old, and 1% were in pregnant women. Additionally, malaria mortality has decreased by 40%, dropping from 8 deaths per 100,000 population in 2023 to 5.7 deaths per 100,000 population in 2024. However, despite this overall decline, the first half of 2025 has seen a 16% increase in malaria incidence compared to the same period in 2024, rising from 205 to 237 cases per 1,000 population. On a positive note, malaria mortality continues its downward trend, with deaths reducing from 4 per 100,000 population in 2024 to 3 per 100,000 population in 2025. These statistics underscore both the progress made and the ongoing challenges we face in the fight against malaria. It is vital that we remain vigilant and strengthen our interventions to sustain and accelerate this positive momentum. The purpose of commemorating SADC Malaria Week is to raise regional awareness about malaria burden and promote coordinated efforts among Southern African Development Community member states to reduce and ultimately eliminate malaria. It serves to highlight the importance of resilient health systems and community involvement in the fight against malaria. The observance encourages timely access to quality malaria prevention, diagnosis, and treatment services for all people, emphasizing that these services are a fundamental right. Additionally, it provides a platform for sharing progress, challenges and best practices, fostering collaboration and commitment towards achieving malaria control and elimination goals in the region. In the Zambian context, the theme, resilient health systems and communities key to malaria elimination, along the slogan, timely access to malaria services, everyone's right, reflects the country's commitment to strengthening its health care infrastructure and empowering communities to effectively combat malaria. Given that malaria remains a major public health challenge in Zambia, building resilient health system means enhancing the capacity of health facilities, improving supply chains for malaria prevention and treatment tools, training healthcare workers, and ensuring consistent availability of quality services even during peak transmission seasons or other health emergencies. At the same time, engaging and educating communities is vital to promote the use of insecticide-treated nets, early diagnosis, and prompt treatment. The slogan reinforces the principle that every Zambian, regardless of age, gender, or location, whether in urban or remote rural areas, has the right to timely and equitable access to malaria services. Together, this theme highlights Zambia's dual focus on systematic health improvements and community participation as essential strategies to reduce malaria incidence and mortality and timely moving the country closer to malaria elimination. The statistics I've shared today are not meant to discourage us. Instead, they serve as a powerful reminder that all is not lost. Despite the challenges we face, each one of us has a role to play. We have an opportunity to change the course of the fight. Together, we must unite and stand strong. We must work hand in hand, fight shoulder to shoulder, and inspire hope. With the tools, innovation, and interventions already at our disposal, the elimination of malaria is possible. Countrymen and women, new dawn government of the Republic of Zambia, under the leadership of His Excellency, Mr. Hakainde Hichilema, the President of the Republic of Zambia, is firmly committed to providing quality health services and implementing evidence-based malaria interventions as closer families and communities as possible. Our efforts are guided by the 2022 to 2026 8th National Development Plan, which is anchored on 4 key developmental pillars: economic transformation and job creation, human and social development, environmental sustainability, and good governance. This comprehensive framework aims to achieve socio-economic transformation for improved livelihoods for Zambians. Through these pillars, the government is dedicated to strengthening health systems, enhancing community health outreach, and ensuring that malaria control remains a top priority in improving the well-being and prosperity of our nation. Additionally, the overall goal of the National Health Strategic Plan 2022 to 2026 is to improve the health status of the people in Zambia in order to contribute to increased productivity and socio-economic development with a vision of a nation of health and productive people. As exposed in the strategic document, it is that a nation that is burdened with the diseases cannot attain socio-economic development. A healthy nation contributes to economic development. The Ministry of Health's National Malaria Elimination Strategy Plan 2022-2026 emphasizes our vision of malaria-free Zambia. Our strategic goal aims to lower the burden in high transmission settings, eliminate local malaria infections, maintain a malaria-free status, and prevent reintroduction and importation of malaria in areas declared malaria-free. Countrymen and women, the strategic plan further outlines the need to achieve universal coverage with at least one vector control intervention, which includes indoor residue spraying, distribution of long-lasting insecticides, treated mosquito nets, and larval source management in eligible settings. Other key interventions include case management focusing on prompt testing and treatment of malaria cases, health promotion to increase uptake and correct use of malaria interventions. Measures have been put in place to address current malaria situation. Notable among the key interventions are: 1, the launch of malaria vaccine as part of the Ministry of Health expanded program on immunization, positioning Zambia as the 24th country to introduce the malaria vaccine. 2, the ongoing indoor residue spraying program, targeting to spray approximately 793,462 eligible structures this year to protect 3.4 million people. 3, the planned 2026 mass ITN, that is insecticide-treated nets campaign. Government supported by partners intend to procure and distribute 11.1 million nets to protect 23.3 million people. It is an ambitious and vital initiative. Additionally, the ongoing routine distribution of mosquito nets to expectant mothers and children under 5 through our local clinics underscores a comprehensive approach to malaria prevention. These efforts collectively contribute to safeguarding vulnerable populations and advancing towards malaria elimination goals. Number 4, government, in collaboration with key stakeholders, have trained and deployed more than 26,000 community health workers, with one community health worker responsible for a population of 500 people. Around 33% of the total malaria cases in 2024 were seen and managed by community health workers, bringing health services as closer to the people as possible and confirms government's resolve to improving access to quality delivery. Number 5, evidence generation to guide programming and policy. Zambia is among countries, if not the only country on the continent, to have conducted 7 malaria indicator surveys, with the first having been carried out in 2006. We have been consistent in generating data because of the desire to implement evidence-based interventions. This is a great achievement. The survey provides a great opportunity to measure the impact of our efforts in the past and strategize on the best ways to address the malaria situation in the country. It is, therefore, my honor to launch the Malaria Indicator Survey report. It is my conviction that the findings will provide evidence to design and package tailored and appropriate interventions. As we prepare to commemorate the Studying Malaria Week, let us unite to ensure no mother, child, or family members die due to malaria. Everyone has a right to malaria services, and every life must be valued and protected. I would be failing in my duties if I did not acknowledge the invaluable support from our cooperating and implementing partners who have consistently increased their investment in the malaria program. The commitment has been crucial to the progress we have made. As I conclude, I wish to remind everyone that reducing the malaria burden requires both individual and collective responsibility. Let us embrace this challenge with determination and optimism, knowing that our combined efforts can make a lasting difference. Therefore, I urge all Zambians to take the following actions seriously. 1. Pregnant women should take the malaria preventative medicine provided during antenatal care. This to protect themselves and their unborn babies from malaria. 2. Sleep under a treated mosquito net every night in every season throughout the entire year. 3. During the spring campaigns, please cooperate by allowing Ministry of Health trained personnel to spray your homes. The chemicals applied on the walls kill mosquitoes and help reduce malaria transmission. 4. Seek malaria testing and treatment promptly from the nearest health facility or trained community health workers as soon as you suspect you have malaria. It has been an honor and privilege to have updated the nation on the malaria situation and the significance of 25th SADC Malaria Week through this media briefing. Remember, malaria ends with me, malaria ends with you. Together, we can end malaria. I wish to thank you all. God bless you.
It's time to register. The Electoral Commission of Zambia will be conducting mass voter registration across the country from the 13th of October to the 11th of November 2025. If you are 18 years and above, a Zambian citizen and in possession of a Green National Registration Card, NRC, you qualify to register. If you registered in 2020 or during continuous registration of voters and you still have your voter's card, you don't need to register again. During this registration period, ECZ will be providing the following services: new registrations, replacement of lost, destroyed or defaced voters' cards, transfers from one polling station to another, claims for omission on the register of voters, corrections of clerical errors and removal of deceased voters. Registration centers will be open throughout the week from 8 hours to 17 hours. Register now. It's your right. It's your choice. This message is brought to you by the Electoral Commission of Zambia.